it's Elisa Marrero again, obviously. And so I'm using the notes again because I have an auditory processing issue called APD. And I feel like it's better for me, just to have my ideas written down in front of me so ahead of time. So here we go. We have been asked to connect themes we covered this semester with the U.S. healthcare system's tackling of the COVID-19 virus. So historically, making progress in providing all Americans with affordable and dependable healthcare has been an uphill struggle. Presidents such as Harry Truman, Richard Nixon, and Bill Clinton all afford proposals to extend healthcare to the uninsured, and for the most part, they failed. Two presidents, Lyndon Johnson with Medicare and Obama with the Affordable Care Act, however, made tremendous progress in this area. With Medicare, President Johnson granted health care to those over 65 years of age. With the ACA, President Obama gave coverage to about 31 million previously uninsured Americans. So just think of what a difference of Medicare, Medicaid, and the ACA have made in this year. How many infected persons would have skipped getting medical care without an insurance card? So many of the uninsured sick would likely have waited to go to the hospital only when they started having trouble breathing, but by then it was possibly too late. Universal health care coverage is not a gift from the rich to the poor, but a way to help keep all healthy. COVID has also shown that citizen activism is an important tool to make progress. Like the AIDS crisis in the 80s and 90s, everyday Americans made it clear that they expected action from the federal and state governments. Pharmaceutical companies, working with government health agencies, developed in record time effective and safe vaccines. Yes, almost miraculously, medical progress today is faster than what could have been dreamed of even 5 years ago. In less than a year from when the COVID crisis began, vaccines were developed and tested that have proven to be safe and highly effective against the virus. If we are lucky, what was learned will be useful in fighting other diseases as well. Yet, vaccines are just liquid in syringes until they are distributed and used by everyone everywhere. A substantial majority of people must be vaccinated to reach herd immunity and thus effectively contain COVID. Otherwise, the virus is here to stay. Who better than social workers to help doctors and nurses get the message out by saying, get vaccinated because your life and your loved ones' lives depend on it. So thus far, about 60% of the American public has gotten the message, but that is not enough to get us across the finish line. We saw this semester how fake science, such as social Darwinism, for example, once supported and promoted racist ideologies. Well, it's happening again. Anyone so inclined can find disinformation on the internet, such as crazy conspiracy theories and outright denial of the seriousness of the COVID-19 virus have led millions of Americans to skip vaccine protection. People have been told that masks won't work, or even they make the COVID problem worse. Indeed, social workers have had to deal with a lot of nonsense and dispelling lies and hoaxes. No doubt about it, COVID messed with everyone this year. We had an empty NC State campus, closed restaurants, and a lot of unemployed people. This was a perfect recipe for widespread depression of the clinical kind. Depression comes out of a sense of hopelessness and shame. COVID was the spark that brought it out in the open. Thus, our mental health system has been challenged as much as our hospitals and recovery facilities. Fortunately, technology has been most useful in enabling virtual counseling and psychiatric sessions. This semester, we saw how historically our healthcare system confronted the challenges of the flu epidemic of 1918, tuberculosis, polio, AIDS, and so much more. Sometimes we responded better than other times. Our generation faced a global health change, but it won't be the last time. Thank you.